So let's talk now about contact tracing and how it's used for COVID-19 prevention. Every case of COVID-19 that's diagnosed requires action. We have to act. And there are a number of ways that we have to act. First, we need to support the person who is infected. It's important that we act to ensure that they have access to medical care and any social services they may need. They need to be able to access treatment. Right now, we only have basic supportive treatments available, but one day, if we have other treatments or curative treatments, they would need to be identified so they can be offered those curative treatments. We also need to act to be sure that those cases are limiting their contact with other people. This is important because someone who's infected can infect others. And part of our goal as public health practitioners is to prevent the spread of COVID-19. So when we diagnose a case, we need to find them, offer them medical support, and also make sure they're changing their behavior to limit their contact with other people to reduce the risk of transmission. Next, we have to also identify all the people that they may have infected. We have to notify them about their exposure and offer them some social services that they may need. If they develop signs and symptoms, we also need to make sure they have access to medical care and offer them treatment. And importantly, we need to limit their contact with other people. So once we find people who've been exposed, those people could become infectious and then infect other people. So if we can get them to change their behavior, we can limit transmission onward. So the basic idea behind contact tracing is that if we can limit contact between people who are infected and others, then we can limit opportunities for this virus to be transmitted. And this is vitally important for COVID-19. This is one of the best ways that we can limit the spread of this disease. Let's also recall the timeline of infection and infectiousness. So here we can see that someone has been infected. You can see in the orange line their incubation period, and that's the time between when they become infected and when they develop signs and symptoms. Then you can see in the blue line, after they develop signs and symptoms, how long they'll have the disease. And then in yellow, you can see again the time period that this person is infectious. And that means the time period when they can infect other people. This timeline shows that people can infect others up to 2 days before they themselves feel ill, particularly on the day of illness and throughout their illness period. Now, if we assume that someone was infected or exposed to this person and infected on the day that person became sick, if we assume they have a 5-day incubation period, they're going to become ill 5 days later. We can also think about their infectious period, which would begin 2 days before they became sick and would last throughout their illness period. So the point of contact tracing is to find those contacts and ask them to stay home so they don't infect anybody else. And as you may recall, that window of opportunity to find them before they themselves become infectious and could infect someone else is pretty quick. And so this is important to keep in mind when you are finding contacts and tracing contacts. This whole system of finding cases and contacts has to happen on a very short timeline to be optimally effective. Isolation and quarantine, which we'll define shortly, can have a big impact on reducing transmission because they serve to limit contact between people who are infectious and others. And as we know, stopping just one transmission chain can prevent many future cases. As you can see here, if each infected person infects 2 other people, an outbreak can grow very quickly. However, If we can stop just one of those people from being infected at each step, we can really have a big impact on the total size of the outbreak and reduce transmission. So now let's be very clear and define what we mean by case, contact, isolation, and quarantine. Those are important concepts that you'll have to really understand well throughout the rest of the course. So let's define what a case is and what a contact is. A case is someone who has COVID-19, someone who could infect others. Usually this is defined by a positive laboratory test, a PCR test usually, and we've already discussed that. Sometimes we may refer to cases that are suspect or probable cases, which means they may not have had a test yet, but we think they probably have the disease. So that could be someone that you know was exposed to another infectious patient, so you think they probably have it, but they just haven't had their test yet. But sometimes we refer to them as cases as well. So a contact is someone who had contact with a case while they were infectious. So basically, this is someone who's been exposed to someone who was infectious. And we care about contacts because they could have been infected. And because of that, they need to take special precautions. So if you'll recall, a case is infectious during their illness and the 2 days before their illness began. So you'll want to identify people who had some kind of contact with them during their infectious period. And when we talk about contacts, there are really 3 different kinds of contacts that we could think about. The first is direct physical contact. So anyone that had physical contact with someone who's infectious is at risk for infection. They are definitely a contact. We also talk about close contacts, and I want to define what a close contact means. So this means someone who may not have had any physical contact at all, but was close to the person who's infectious. They were within 6 feet of this person for at least 15 minutes or more. Now, 15 minutes is just a guideline. In some places, they'll ask about close contacts who were nearby the case for 10 minutes or more, or maybe 30 minutes or more. So there's some flexibility there. You'll need to talk with your jurisdiction where you're working to figure out exactly how they're defining a close contact. But this is the basic idea that you're nearby the person who's infectious for at least some period of time. And you're within 6 feet, which, if you'll recall, is the distance that respiratory droplets can travel. There's a third type of contact that you may also want to think about. And those are people who have been in the same room for an extended period, maybe an hour or more, with the infectious person, but they were more than 6 feet away. So sometimes these people could also be at risk. They may have had contact with the same surfaces, for example, of someone who's infectious. These are called proximate contacts, and sometimes you'll also be looking for these types of contacts when you're doing contact tracing. Now let's define what we mean by isolation versus quarantine. Both of these terms mean that someone is going to distance themselves from other people. Someone is going to stop having contact with other people. But they mean slightly different things, so let's be clear about these. Isolation means keeping sick people separate from others, from healthy people, or any other person. This can be done within a home, so you can restrict yourself to your home. If you live with other people, you would also need to keep from having contact with other people even within the home. If you're unable to do that within your home, then you may need to go somewhere else to isolate yourself from other people. And some places, people may go to a hotel or find another place where they can be separate from others. In hospitals, patients will have to have a separate space and have very limited contact with anyone else except healthcare workers who are wearing the appropriate masks, gloves, and gowns to keep them safe. How long should someone isolate from other people? Well, it should be for the duration of their infectiousness. And as we've already discussed, that will start 2 days before the onset of their illness, and it will last through the duration of their illness. Some people are sick longer than others, so their infectious period will be longer than others too. But in general, we would say that someone can stop isolating themselves from others safely if it's been at least 10 days after the onset of their illness, all of their symptoms are improving, and they haven't had any fever within the past 3 days. And this means that they haven't had fever in the past 3 days, and they also have not been taking medicines to suppress their fever for the past 3 days. So it's important to check that. So quarantine means restricting the movement and contact of healthy people who've been exposed with other people. So we isolate a case, but we quarantine contacts because they've been exposed and they could become infectious. Contacts should be quarantined for 14 days since the last contact they had with the infectious patient, the person who may have infected them. So it's important to know when their contact was to be able to figure out how long they need to quarantine. As a contact tracer, you'll need to be able to calculate how long a case should isolate and how long a contact should quarantine themselves. It'll be based on your understanding of their infectious period, and it'll be an important component of working with cases and contacts to limit the spread of disease. So let's go through some examples, very practical examples using a calendar to see how this might work. So how long should a case be isolated from others? Well, the short answer is ideally as long as they're infectious. But there is a longer answer. We know that by the time they're diagnosed, they may already be sick. So by the time you're investigating this case, their infectious period has already started, probably at least a few days before. So you'll need to talk to them about isolating themselves for the duration of their infectious period. They'll have to monitor their symptoms each day to help you determine if they're still infectious and if they've recovered. And remember, they'll need to isolate themselves at least 10 days after symptom onset, and they'll have to know that their other symptoms are improving and they haven't had fever for 3 days. So let's see practically what this will look like. Let's assume that you identify a case and you call them on May 10th. During the conversation with them, they tell you that they became ill on May 9th. So now you know that they were infectious for 2 days before they became ill, and they will be infectious for at least 10 days after their onset. So that means May 9th plus 10 days equals May 19th. So you can see here in blue their total infectious period, which started 2 days before their onset of disease and went all the way through May 19th, which is 10 days after the onset. So we know that the case will be infectious at least through May 19th in this example, but you'll need to have continuing follow-up to see when they can stop isolating from others, because you'll need to know when their symptoms resolve without use of medication. So the 19th is the earliest time that they can stop isolating, but just a reminder that you'll need to be following up with them to see if they can really stop isolating on the 19th or not. So on this slide, the days of their infectious period are shown in blue, and we assume that we called the case on May 10th. And you're going to ask them about the contacts they had since May 7th. Those are shown here also in yellow. We assume that after you call them, so from May 10th through May 19th, they're isolating themselves, so they're not going to have any additional contacts. So in your discussion with them on May 10th, you'll need to list out everyone they had contact with since May 7th. Now that you've identified the contacts, you'll need to help them calculate how long they should quarantine. So how long should a contact stay in quarantine or distance themselves from others? The short answer is, ideally, as long as they could be infectious, which means the 14 days since their last contact with someone who is infectious. So there's a longer answer, though. Again, it's 14 days since their last contact, because we know almost everyone who's infected will develop illness within 14 days. However, by the time that you're having a conversation with the contact, their contact with the case may have been days ago. So you'll need to figure out how much time they should quarantine from the time you talk to them. And in other examples, the contact may be ongoing. So for example, they live with the case, they live with someone who's infectious. So that will require some additional calculations. It's important to note also that when you're having a conversation with a contact, if they've developed symptoms, they should probably be considered a case. And so then you would talk to them about isolating rather than quarantine. Now let's think through a specific example. Remember the case we already talked about? Well, let's assume that you're going to call one of their contacts and you're able to have a conversation with this contact on May 13th. And on the call with this contact, you understand that their last interaction, their last contact with the case was on May 10th. If you recall, that's the second day of illness for the case. So they should receive instructions to quarantine for 14 days since their last exposure to the case. If their last exposure was on May 10th, you would add 14 days. And so that would mean that they should quarantine through May 24th. So we already mentioned that if a contact lives with a case, then figuring out their quarantine period could be a bit more difficult because their quarantine period is going to be longer. So the contact should quarantine themselves immediately and then also for 14 days following recovery of the case, because that would be the last time they had contact with an infectious case. So for some contacts, quarantine is going to be longer than 14 days. Let's just see what that would look like on the calendar. Let's assume, same scenario, we call the contact on the 13th of May. And it's the same case, but they live with the case this time. So the person that they live with became ill on the 9th. This is the case we talked about before. Let's also assume that the case will be fully recovered by the 19th. This would be 10 days since their onset of illness. Therefore, if the contact has to quarantine themselves for 14 days after their last infectious contact, then they would need to quarantine through June 2nd, because that would be 2 weeks after the full recovery of the case that they live with. So you can see in this example where the contact lives with the case, their quarantine period is going to be almost 3 weeks long because they'll have to quarantine themselves while they're still having contact with the case and for 2 weeks after.